All right, doing this again. Let's see. Gonna invite Michael to the chat. And today we're having a conversation about pleasure with Michael Shifra. I'll have her introduce herself. She's a former doula. Aha, there you are. We worked.
Hi. It's never a real Instagram live or Zoom without some technical difficulties.
I entirely agree with you. That is so very true. Well, welcome to today's conversation. I'm really, really excited to be talking with you. I'll give you a moment to introduce yourself, and then I'll introduce myself, and then we can kind of hop into some of these questions I've got for you.
Yeah, for sure. Hi, everyone. Oh, hi, Patty. I see some people coming in. My name's Michael. I use she or they pronouns. I've been a doula in LA for about 7 years, and I'm a student midwife now in residency. So meaning I'm practicing as a midwife under supervision, and I do mostly home births, and I've been a sex educator for a really long time. And since I can basically remember from childhood, I've just been really interested in just the whole scope of reproductive health. So yeah, I thought I was kind of weird as a kid, but I just love it.
I love it. I feel like we're passionate about so many things, and I'm really excited to dive into this conversation with you because when we did our pre-interview, there were so many things. Like I had questions, and then you had so many great ideas about things to share. And I feel like it's going to be really interesting and very informative. My name is Alex. I use she, her pronouns. I am the social media director for Repro Film, which is an organization at the intersection of art and advocacy. We produce a free digital periodical every month centering some element of reproductive health or justice with a short film, original podcast, literacy items. This month is pleasure, which is part of the reason that we have you on today, Michael. So I will jump in with a question about the anatomy of the clitoris, and if you can walk us through that.
Yes. Do you think if I show an illustrated picture, that would be okay? Or do you want me to just keep it to verbal stuff?
No, I think a picture is fine.
Okay, so I'm going to show a really tame picture because Instagram loves to censor me. So this is from one of my favorite books. It's called A New View of Women's Health. It's a super old book. It's completely coming apart. If you ever find one in a bookstore, snatch it up immediately. But essentially, it's a group of women from the 60s that learned clitoral anatomy by drawing on and experimenting on each other and themselves. So this is the only anatomy that I know of the clitoris that's drawn from a live person and not from a cadaver. So cadaver anatomy looks super different from live anatomy. And most of the time, care providers, such as me and doctors, are learning from cadavers and not from real people. So this is a real person. This is a super tame Instagram illustration. So here's someone's legs up and their vulva would be here covering this area. So all you're looking at right now is the internal structure of the clitoris. So the part that you can see is this little, this little part right here is that external part that most people think of as the clitoris, but it actually has this beautiful, amazing erectile tissue that comes down underneath the inner lips, and it has these things called crura that come down around the side. So it actually is this whole structure, like behind the whole vulva is internal clitoral structures.
So can you tell me with what they're called, because I don't know the wings on either side?
Yeah, those are there's the bulbs and the crura, and a penis also has bulbs and crura. So we really just have the same exact anatomy as a person with a penis. It's just internal. We have the same amount of erectile tissue as a penis, which most people don't know. It's also just internal. So people with vulva get boners, just like people with the penis get boners.
I love it.
And I do think they're pretty noticeable. So if you want to see, here is a clitoris at rest and then a clitoris erect. So you can kind of see the dotted lines are erect and the more solid lines are at rest. So it really does kind of engorge and become erect the same way a penis does.
This is like the coolest possible conversation that we
And I was thinking I'll maybe do an Instagram post and explain more in depth with like, because this one doesn't really have words on it, but just to orient you, all of this darker tissue right here is the internal structure of the clitoris. This right here is the bladder, and you can see how the clitoral anatomy actually wraps around the urethra. And then this right here is the vagina and the uterus. And then this is the booty in the back. So all over this area, you have all of this dark tissue is erectile tissue of the internal structure of the clitoris.
So cool. So would one set go around labia majora and then the other go around the labia minora, or it's around?
Yeah, kind of, but it's also just, it's kind of hard to conceptualize three-dimensionally. Like, it's not just like clit and vulva on top of each other, but I can try and show you a different picture that'll give you a good idea. I'll show you this sideways picture. And another thing that's pretty cool is a lot of people talk about like the differences between internal and external orgasms, like orgasms from the external clitoris and the internal, but it's really all the clitoris. So I don't really like to be like, it's not a clitoral orgasm, it's a vaginal orgasm. Like, it doesn't matter where penetration or like stuff is happening, all orgasms are centered in the clitoris, and the clitoris also can be accessed from in the vagina and in the anus. So if you're having penetrative sex and you have an orgasm, it's a clitoral orgasm.
So cool. I remember reading, I think it was Vagina by Naomi Wolf, and it cites some information that I hope I'm not misquoting about a pelvic neural structure that was separate from the clitoris. Is that something that you know about, or is it all just?
There's this myth around the clitoris that it has like 6,000 or however many thousand nerve endings. So that's actually not true. That study was only one study that was based on livestock of sheep. So when we're talking about the clitoris having that many nerve endings, we're only talking about sheep. I forget her name. There's this awesome woman that does a lot of education around the clitoris, Jessica something, I'm like blanking on her right now, but she's done a lot of clitoral dissections, and there's not 6,000 nerve endings. The nerves that go in the clitoris also innervate other parts of the pelvis, so I kind of see it as like one whole structure, not really like you have your reproduction and you have your pleasure and they're separate. It's all kind of in there together.
Yeah, because my understanding is that some people with this, you know, like, mind you, I'm just going to ask these questions. If anything feels uncomfortable, let me know.
No, it's fine.
I eradicate shame around all these things and let people have some understanding about their bodies. But, you know, some people experience more anal pleasure, some perineal pleasure, some even cervical pleasure. How does that tie into the relation to the clitoris? You're saying that once the clitoris is stimulated, then it innervates other parts of like the pelvis?
So here's a side view of a clitoris with a woman actually touching her G-spot. So you can see this dark tissue up here. That's also clitoral tissue. It's just internal.
So cool. Okay.
And it's really hard to get oriented when you're talking about a 3D human, but you're looking at like paper anatomy. But I can definitely do my best to like post some stuff after this so people can have like a better understanding of like kind of what's going on and how to like orient themselves.
That's great. Thank you so much for walking us through all of that.
You're welcome.
It's me to my question, which is, what do you see as major contributing factors to people with vulvas being able to experience sexual pleasure? And how can we move past?
I think a lot of people with vulvas, especially like cis women and people in hetero relationships, they kind of think pleasure has to look like one thing. And I also noticed a really big, like in my own midwifery practice, I noticed a really big barrier between like people and like sexual tools. So like I see lube as a sexual tool. It's not a moral failing if you need lube or a vibrator. It is simply like a part of how like many people experience sexuality in a totally normal way. So if anyone is experiencing like pain or discomfort, I like urge you to not push through that. I urge you to find solutions with your partner or with your own anatomy to kind of work around that. So a lot of times, especially like women in hetero relationships will just kind of like push through the like difficult parts of sex or things they don't like or things that might hurt. And so I really want to encourage people to know that there's so many tools out there that can help you have really fun, amazing sex without being in pain.
Yeah, I love in the piece that you wrote for Repro Film, 6 Things a Midwife Wants You to Know About Pleasure, which y'all should read because it's really great. You talk about if you go out to dinner, and you wouldn't feel any shame asking for a napkin, for example.
Right, exactly. There's this weird stigma that like when you need to have sex, it's just a person with a penis and a person with vagina like doing this rhythmic thing until the person with the penis comes to completion. And that's just really like one really narrow view of what's going on. And so I really just want to encourage people to kind of really tend to themselves before and after sex. Like do you need to take a break because you're thirsty? Like that is totally okay. Do you need more lube? That is ideal. Like lube is amazing. Do you need sex toys to come? That's normal. Like a lot of people don't come from just stimulation from themselves or a partner. Like they need vibrators and stuff like that, and that's like nothing to be ashamed of. It's actually super fun and awesome. So
Yeah, and provides more opportunity to explore. I think it just speaks to who's controlled the narrative around sex and sexuality for, as much of the past back to, at least. Now we're starting to move into a place where people are maybe a little bit more liberated and starting to understand their bodies. And yeah, that's all really exciting. So, as we talked about the things that someone might do to experience more sexual pleasure, what do you imagine a person with a vulva, or have you experienced a person with a vulva who knows about their body feels like? Can you help us imagine a future where shame is released and people have a healthy relationship to their bodies and sexuality?
I mean, I really hope that that's the future that we're coming towards. Gen Z seems to be pretty on top of that. They're all pretty queer and liberated from what I can tell, at least in Los Angeles so far, which makes me very excited. But I think it really starts just being young and like teaching kids that like sex is nothing to be ashamed of, and teaching them about consent, and like this is like something that adults do with consent, and just teaching them so that they're not personally abused, and that also they have a healthy understanding of what like a healthy sexual relationship can look like. And I know teaching sex ed to kids seems like really uncomfortable and far out for some people, but you can also hire someone like me to do that, and I'm happy to talk to your kids about it. I recently taught a Girl Scout troop that was like 9 to 11, and we mostly went over like puberty and body kind of stuff, but the like difference in the way that they look at these things versus how my peers did in the early aughts is like so incredibly different and amazing.
Oh, in what way? That's so cool.
Just they already knew, like I definitely I taught them about gender and stuff, and I was like, how many pronouns exist? And they were like, 3 pronouns. And I was like, there's actually unlimited pronouns. But the fact that they knew that there was they them pronouns, and they were like, we have friends that use they them pronouns, like that was really cool. And it was just like normal. They were like, yeah, we obviously know about that kind of thing.
Yeah, absolutely. That's so cool. I also love that you teach sex ed to kids, because I remember growing up in North Carolina, my own sex ed program was, abysmal. And I also, this brings me to my next question, which is, at what age do people with vulvas wake up to sexual pleasure, and how can parents recognize and keep that safe? Because anecdotally, in conversations that I've had with female friends, women friends, a lot of them have said that they started masturbating or realizing what their genitalia was when they were around 4 years old, 3 or 4 years old. And then there's like a huge drop off out of that people come into puberty. And then it seems like it picked back up when they were maybe like 15 to 19, something like that.
Yeah, and I think that's partially just how humans' hormones are released and at what times in their lifespan. But I also think it's a little bit more cultural. When it's nature or nurture, I'm always like, it's probably both. I hate that like academic argument. I'm like, it's almost always nature and nurture. So from like a nature perspective, like babies are masturbating in the womb, they're tugging on their cord, they're touching themselves. We see that in ultrasounds. It's just the reality. Babies do that also if you take off their diapers. Baby boys get erections. Baby girls can even get a first period in their couple first weeks of life, because they actually go through like really big hormone changes right at the beginning of life. So you actually see them have acne, and some baby girls get like 1 menstrual cycle, which is super weird, but actually pretty common. And then, yeah, there is this kind of drop off. And I think that's partially because there's just that initial hormone surge in the beginning and then again at puberty. But I also think that people kind of like shame their kids out of that kind of stuff, or they like know it's wrong or bad. And I'm from like a Jewish family in Los Angeles, so I don't have a lot of like the baggage that a lot of people that grew up in really conservative families might have necessarily.
Mm-hmm.
But I do think that a lot of people, like a lot of kids I've like nannied or work with, their parents will be like, oh, that's dirty, like that's not something you're supposed to do. And I think there's definitely a way to tell your kids not to masturbate in public and that it's not dirty. Like, I think that you could hold those two things together at the same time, keeping them safe, but also just letting them know that it's a healthy reality, that a lot of people do that. It's just something to do for now in private.
Yeah. We have a conversation I had with a friend who was talking about, I think this is really sweet. He was talking about his sister having, when she was maybe 3 or 4, just kind of like rubbing herself on the floor in her diaper. And the parents very wisely were like, okay, so this is great that you know your body. There's nothing wrong with this. Just know that you should do something like that in your bedroom with the door closed by yourself, maybe instead of doing it in the middle of the living room. But they tried to do it in a way that was like, that's totally fine. Just maybe don't do it in public.
Yeah.
Which pretty, I think, pretty progressive, considering what I think some parents' reactions might be to something like that.
Yeah, absolutely.
Yeah.
And I don't have like a perfect answer. I think every family and every kid is really different and every community is really different. But I think at the very least, just reducing that shame and not telling them lies like that's dangerous or that's gross, and just more so centering it about keeping them safe, teaching them how to interact with other people, ask for consent, and be able to have your own body autonomy to say no to things, most importantly.
Yeah, boundaries, bodily autonomy, communication, and knowing oneself, I feel like, are some pretty important, what am I saying, pillars around
Mm-hmm.
something we can embrace a little bit more. Okay, so I want to switch directions and ask you about something that you brought up in our pre-interview, which is the history of colonized terms around the body and what words we might use instead. Can you educate us about that?
Yeah, I mean, one of the most commonly used terms is like labia minora and labia majora. So I use inner and outer because
Mm-hmm.
minora indicates something is smaller and majora indicates something is bigger. And most people actually don't have bigger outer lips than inner lips or inner labia. So I like to use the words inner and outer because it's just more correct, to be honest. And it produces less stigma for people that do have larger inner labia, which is actually normal. I don't know the percentage, but it's probably like half.
Okay, wow, that's really good to know. I even used Menorah and Majora in this conversation already, so I'm going to switch to inner and outer.
Yeah, and I think it's also like it's totally okay for people to use medical terms that also just like make sense. Like inner
Mm-hmm.
and outer, everyone can understand that. Minora majora kind of makes it more medicalized and like confusing
Mm-hmm.
and also just like is incorrect. But my biggest pet peeve is not around those. It's actually around just the ones that are named after men. So like the G spot is the Gaffenberger spot. It's the clitoris. It's another part of the clitoris. That guy did not invent squirting. He did not invent the G spot. He just named it after himself. Um, Also, like the Skene's glands, the periurethral glands, there's a lot of parts of the female pelvis that are named after the people that discovered those nerves or anatomy parts.
Mm-hmm.
The pudendal nerve, which innervates into the pelvis, is pudendal means nerve of shame. So that's just named your nerve of shame. It's in female and male anatomy, that one, but yeah, it is. So the pudendal nerve is the nerve of shame. I think it's Latin or something for shameful. So just as another example.
Oh, wild. I mean, is this something that keeps with the ways that anatomical structure has been named in the body historically? Is most of our body named after the people who discovered them?
Yeah, and discover even is like way too lenient of a term because a lot of these men were working with J. Marion Sims and other early gynecologists that exclusively experimented on enslaved women without their consent. So even colonized is kind of a lenient term, like this was just torture.
Right.
Um, for people that could not consent, did not consent. And that really like still persists in medicine and in our culture. Like it's like that's seen as normal in medicine a lot of the time. And those just like remnants, although most people don't know the exact history, those remnants still very much affect the way that people are treated during medical exams and pap smears and that kind of stuff today. So for me, it's really important to just change that language altogether. And also, why is it named after people? Like paraurethral ducts on either side of the urethra, like that makes more sense to me than like naming it after a man that like experimented on enslaved people. Like, why would we do that? That's gross.
I agree with you. It's just, you know, I mean, it's not unsurprising, but kind of wild that they would do that. I have another question that I have around pelvic exams and consent with pelvic exams and how one might advocate for oneself. You know,
Yeah.
well, yeah, go ahead.
So absolutely. So pelvic exams are sometimes completely unnecessary and doctors just do them either because they want students to practice or it's just kind of their routine. So first asking like why you need a pelvic exam. So this includes in labor, when you're pregnant. We don't do cervical checks until the person is like basically pushing usually. Like the amount of cervical checks most people get in hospitals are way too many. They can cause infection and they're just really uncomfortable. So you're doing all these cervical checks throughout your pregnancy for basically no reason because they don't really give you good information. And then additionally, I definitely have doctors try to coerce me into having pelvic exams, saying I couldn't get medication unless I had a pelvic exam with them. And then there's a lot of people that are, there's a lot of doctors that are doing non-consensual pelvic exams while people are under anesthesia. So that's just something that's completely normalized. That's how most doctors learn is from people that are under anesthesia. So you have doctors that like see cadavers either live or drawn, and a vagina of a cadaver is kind of gaping open and looks very different from a live person. And then you have them practicing on people that are asleep and unconscious. So it's kind of no wonder they're not good at doing it on women that are awake.
Well,
you know, like So first of all, why am I getting this pelvic exam? What information do you want to get out of it? And how is that information going to change my treatment? So are you wanting to do a pelvic exam because it's your routine? And some people might feel totally okay with that, with getting a pelvic exam that's just routine, just to check on whatever you're there for. And other people really want to avoid them almost at all costs unless super medically necessary. Pap smears, I'm a huge advocate for people inserting their own speculums. A monkey could insert a speculum. You do not need a 10-year medical degree to insert a speculum. I personally believe that all nurses should just be trained to do pap smears. Nurses do way crazier, more intense, dangerous procedures than pap smears. So I think that like gatekeeping, that it's only, we do them as midwives too, but that only doctors do them is very stupid. You could insert your own speculum. You could tell them when you're ready. You can even swab yourself in some cases. That's how I do it with my clients, actually. So it was really fun this year at Dyke Day, which is this big lesbian event in the park for Pride. Me and some other midwives, we actually did pap smears in the park. We set up a tent with air conditioning and we had people all day coming in for pap smears. They inserted their own speculums. My really good friend and mentor, Pam, teaches a Take Back the Speculum workshop. So she was there helping people insert them. And then they got the option for us to swab them or for them to swab themselves. And for most people, that's a really radical way to give care, but it's honestly like easier for me. Like, why would I want to put in a speculum for someone if they don't want me to? Like, that's gross. I don't understand why doctors feel like they have to do that part.
Yeah, that's such a good point. And it's questions that maybe, I mean, I wouldn't know to ask if I hadn't been following people like you on Instagram and other professionals who are trying to change the landscape of consent, or just the idea of consent around things like pelvic exams. That's so cool. Thank you for letting us know that.
Yeah, of course.
So I have, changing direction again, I've got two more questions for you. One is, as a former doula and now midwife in residency, what role do you see pleasure playing in birth? And are there overlapping principles that you see in both pleasure and birth?
Absolutely, consent is the absolute biggest one. I always teach consent as like FRIES, so freely given, reversible. Damn it, I'm gonna forget the acronym now. I'm gonna forget it. I'll post it after this. But basically, consent in sex and consent in birth should look really similar. There are so few instances, truly so few, where a doctor needs to be touching you or a midwife or a care provider without your consent. Those are life or death extreme emergencies that are so rare, even in hospital settings. And it is so rare they cannot just take a moment to tell you, like, this is what's going on kind of thing. And usually the moments when people are being touched because it's life or death are not the ones in my experience where they're being traumatized. It's the ones where they're being assaulted for literally no reason. So the biggest thing is consent. If you have a care provider that doesn't respect your consent in prenatals, they're not going to respect them in birth at all. So just kind of take that as a red flag. Having a doula can be helpful, but we don't have superpowers. Like, if you have a crappy provider that's gonna assault you, there's like not a lot we can do about it. So really setting yourself up for the best birth possible is choosing the right provider. And take their red flags the first time. Like, if someone is really flippant about something, like, they're going to be more flippant about it in labor. And also just knowing that care providers, the vast majority of the time, if you have a home birth, we're there the whole time. But doctors really just come in for like that second half of pushing. So a lot of people are like, well, I really like this person's personality over this person, but this person has more my vibes in terms of the choices I want. Go for the choices you want, because that person's only going to be there for like 15 minutes to like an hour. So it's more important that they match your medical values than they match like what's trendy or which friend of yours gave birth with them or whatever. So first thing is consent. Second thing, birth is really incredibly painful. And a lot of people, just honestly, it is for almost everybody. And a lot of people kind of strive for like an orgasmic birth or a hypnobirth, and that's amazing and such great tools. But the reality is that birth is kind of a really painful experience and also a really sexual experience. All your same organs that are involved in sex are involved in giving birth. And so being in an environment where you're safe to do that is really important. If you even think about just like trying to take a poo in front of like 10 strangers, like, that's really hard to do, let alone like push out a baby. So if you feel like you can't do that in front of your team, then that's probably not the team that is going to make you feel safe in the moment.
Right. Such great point. Yeah, consent being the foremost important, and yeah, making note of all of the red flags that one might feel in the initial meeting with the care provider. That's all super important. Okay, so I have one final question, and we can open it up to our audience as well. You can tell us about Slut Soak and what drove you to wanting to create the brand.
Yeah, so Slut Soak is a brand that I created of all organic herbal products. I'm a really big person. I really only like to give people what works. So nothing I make is like making promises that it doesn't really like follow through with. For example, I think there's a lot of predatory herbal products out there that I don't really like, stuff that's harmful for your body. Slut Soak is supposed to be a ritual around sex that's going to heal sore tissues, microabrasions, if you're doing any kink stuff. Because after sex, people just kind of go about their day, and a lot of people do have like pain or soreness after, and they do need to do some self-care in a way where they're cleaning themselves that's not soap or anything harmful. So there's no soap in the product at all. It's just a bath soap that has herbs that are antimicrobial, antifungal, and are super healing for sore tissues. I also make a blend for postpartum because, as you can imagine, after giving birth, you might have sore tissues and tearing. And it's just really important to take time to tend to yourself after sex. Not everybody has to, but it is a big physical event. Like, you go to the gym afterwards, you'll get a smoothie and you'll drink a bunch of water. Like, anytime you're doing a big physical event, it's ritualized in our culture to like tend to your body around those things. But in sex, people just kind of go about their day and have all of this discomfort. It can also be a really good just emotional check-in with yourself if you want to like prepare a bath for your partner and kind of ask them like, what was your favorite part? Like, what would you want me to do differently? And just merely making sure that that person had the best time they possibly could. Because I think some of the parts that happen after sex can almost make or break what happened during, and can really influence the next experience you have with that person if you do have one.
100%. That's all so great. Well, thank you so much for all of that information, Michael. I want to open it up to the audience if anyone has any questions, or if you have anything yourself that you'd like to share that I haven't asked in this space.
Yeah, I think we've gone over most everything. I loved your questions so much. I'm
Oh,
just going to pull them up.
also, Mama Bella Dula, thank you for all of your lovely affirmations in our chat. And
Thank you.
some of the chat is scrolling in front of your face, Michael. I'm trying to make it disappear, but I'm new to this and I'm not entirely sure how to make it disappear. But yeah, does anyone have any questions for Michael? Well, say we can do a little outro and I'll talk a little bit about what is going on with Repro Film and if you have anything that you would like to mention yourself, if you want to go first.
Yeah, absolutely. Everything was so important. Oh, you're so welcome. Mama Bella Dula just said that they're a birth trauma researcher, and everything I mentioned is so important. It is really important, and I know this is a chat about pleasure, but I always just want to let people know that if they had a really traumatic birth experience, you are not alone. In fact, you're far from it. The way people are treated in those situations are really unfair and horrible. And I just really encourage you to try your best to set yourself up for the best experience and get the care you need afterwards to process anything that happened, good or bad. So yeah, thank you so much for that. Oh, someone said I bought my speculum from you last year. Yeah, in my Etsy store, I also sell speculums, so people can learn to do their own self-exam so that they're comfortable when they go into their provider. They've like practiced it before. So if you want to check out my Etsy shop, I'm at slutsoak.com or etsy.com/shop/slutsoak. And I have cures for BV and yeast. I have my soaks, and I also have speculums to try.
Amazing. When I post the replay of our Insta Live, I'm going to put all of that in the comments or in the captions so people can access it later. And then I would just say, oh, the key is processing is such a good reminder. Oh, what are your tips for the infinite pronouns and gender expression from Mama Bella Dula? That's a good question.
Oh, for just like referring to other people? Or
they say the key is processing and such a good reminder for sex. What are your tips for the infinite pronouns and gender expression?
I always just ask people's pronouns. Sometimes I'll just default to they, and if people correct me, I'll change them. It's such an like people kind of treat pronouns as like I'm not saying this person is saying that at all, but a lot of people think like learning new pronouns for someone is like such a chore. And it kind of is in some ways, but it's just the amount of work you have to do versus the amount of good it does for the other person is just like so monumental. So just know that when you are affirming someone's gender, you're warming their heart, you're reducing suicide rates in trans people, and you're making friends. So try your best.
Absolutely, absolutely. Yeah, I totally agree with you. Um, okay, so yeah, I guess I'll just wrap up by saying that Repro Film, if you guys want to subscribe to our free digital newsletter, it comes once a month or twice a month, I'm sorry, in your inbox. This month we're focusing on pleasure. And we have a short film called Marcy Learns Something New, which is about a dominatrix or a widow who takes a dominatrix class and learns about herself in the process. And the last thing Mama Bella is saying after
With Rachel Dratch, who I love. I can't wait to watch it. I love Rachel Dratch so much. I saw that and I was like, is this what they made or is this from a real movie? Or like, I was like,
no,
what? This
so
is like amazing.
yeah, that we curated. Neha Aziz, our programmer, curated. It's a film by a director named Julia Kennelly, and it's about, I believe, 15 minutes. It's super sex positive. It's really fun. I really enjoyed it, so I definitely recommend checking it out. Oh, and before we go, Mama Bella Dula, after consent, what would be your number one recommendation for accessing pleasure perinatally? Ooh.
So in pregnancy for accessing pleasure, I mean, I don't think it's super different from outside of pregnancy. People's anatomy definitely changes. I'm not sure if you're talking about like birth or like sex in general, but just getting to know your body in the new way as it makes all these changes. Definitely expand your definition of sex. So if it used to be like mostly exclusively P and V, kind of think about what other types of sex would be helpful or more comfortable for you if applicable, and just I mean, do your best to have fun because you're about to have a baby, so it's going to be a minute after you do that before you can have some sex. So
Yeah, is P and V sex safe during pregnancy? is a
Yeah,
question.
almost always, unless someone has like a placenta previa or another medical condition in which they've been put on like pelvic rest. That has also been like up for debate academically whether pelvic rest is helpful in those situations or not. I obviously can't speak to like individuals, but almost always P and V sex is safe up until your water breaks, basically.
Right, and there's a risk of infection.
So even in labor, which no one really wants to do that in my experience, but if you do, that would be great.
Okay, so cool. Thank you so infinitely much for this conversation. It was really enlightening. We're going to get you guys some information about fries in the captions. I love the information you shared about inner and outer labia versus minora majora. So much great information, Michael. Thank you for your time, and thank you to everyone who joined us today. This was great.
Thank you so much, Alex. Bye, everybody.
Bye, y'all.